And as more of us get vaccinated, the prospect of returning to a more normal life is an exciting one. But thousands of Wisconsinites with long-haul COVID fear their health will never return to normal. CBS 58 Investigates Bill Walsh shares two signs of hope for those suffering.
While we've seen COVID-19 cases come down from their peak, long-haul COVID clinics keep admitting new patients.
I think we're up to about 350, and we get about 8 referrals a day.
Dr. Julie Biller leads the dedicated long-haul clinic at Froedtert in the Medical College of Wisconsin. According to the CDC, here are the most common symptoms, but there are many other symptoms like depression and brain fog.
This has been a life-changing infection.
The lasting effects of long-haul COVID are believed to have contributed to the suicide of Kent Taylor, founder of Texas Roadhouse Restaurants.
They feel like their bodies are not what their bodies used to be. They feel like different people.
Medical research is still trying to solve the mystery. Why do mild cases of COVID-19 sometimes turn into life-altering long-haul cases?
I would say at least 80%, maybe even 90% of the people that were seen in clinic were never in the hospital.
Some necessary research is already happening.
We started off looking at the effect of these dietary supplements.
Dr. Neha Shah says her work to treat patients with pulmonary fibrosis led her to a potential treatment for long-haul COVID.
Because a lot of the symptoms of COVID overlap with those of pulmonary fibrosis, we thought it was logical to test these enzymes in patients with COVID-19 disease. And we did have a well-controlled clinical trial in which, we found significant benefit.
Shaw says a combination of systemic enzyme supplements and probiotics has promise in reducing symptoms like inflammation and swelling and coughing.
93.3% of patients in the experimental arm showed clinical improvement on day 10, versus only 60% of patients in the control arm.
These are over-the-counter supplements, all natural, commonly available, but Dr. Biller cautions this is one small study.
There are about 12 million people who have had COVID infection in India, and they just did a study on 60 people.
Even Dr. Neha admits more research is needed.
The results of our case series are very promising, but larger placebo-controlled trials will be needed to definitively prove this effect.
Yet another sign of hope for long haulers is the COVID-19 vaccine.
Again, it's kind of a rough study, but 36% of people who received their COVID vaccination had improvement in their long COVID symptoms.
Bottom line, there is no cure, but doctors and scientists all over the world are working to make sure that long-haul COVID is not a lasting legacy of the pandemic.
It is understood to be a major issue to the point that the NIH released a request for grant applications a few weeks ago, and they've told us that they are earmarking $1.5 billion with a B dollars into research.
We'll put the supplements from the study in this story on our website, cbs58.com. But if you're suffering any symptoms of long-haul COVID, this is really, really important. Before you take any new supplement or start any kind of new treatment, talk to your doctor to make sure it's safe for you. I'm Bill Walsh reporting.